Okay, so last time. So all right guys, I'm Daniel Burns. We're going to go over crisis work, the use of RUSAFE tools and tactics. I've been working in crisis for about 9 years in the United States Army. I've done it on the battlefield in Jordan, Iraq, and Kuwait, and also stateside at ERs and in and outpatient treatment facilities. I'm going to go over the learning objectives. I basically want you guys to learn this tool, demonstrate its use, and by the time we're done, be able to demonstrate it in a group format. All right? Sound good? All right, so why are we learning this tool? According to the CDC, California alone has an increased suicides of 14%. Throughout the United States, we had about 45,000 people take their own lives to suicide. 54% of those had undiagnosed conditions, meaning it was preventable. The majority of those were due to firearms. That was across both genders. You always want to assess is level of lethality. So for instance, when someone has suicidal ideation, if they want to take their own life by taking pills versus a firearm, high level of lethality, pills, low level of lethality. All right. Understanding why, and also just to make sure we hit on this, the VA also has very high numbers, and so does the military. On average, according to the VA's recent report in 2018, we still lose about 20 service members a day to suicide. That's service members or veterans. It used to be about 22, but I think in about 2017 it changed and lowered a little bit to 22 a day, which is still astronomically high. All right, so what are things we need to remember? If we're going to a crisis situation, if you're not at an ER or somewhere else like that, never go alone. You should never go alone, never go by yourself, because your safety is most important. Number two is prepare mentally. You don't know what you're going into, you don't know what kind of crisis scenario it is, but your safety is number one. Try to remain calm. Obviously, it's going to get you agitated if it's something you've never seen before, if it's a crisis event like up in Paradise, California, if it's like Katrina event. These are overwhelming events. The people that have done this for years still get overwhelmed. It's a normal reaction to stress. Be sensitive to culture. We always want to remember culture relativism. We don't know what's going on in that culture. We don't want to project our cultural views onto those folks. Have empathy, not empathy, and try to put yourself in their shoes from their perspective. I practiced that a lot in Jordan. There was Muslims from all over Iraq, Jordan, Kuwait, and Syria that were being processed through, and I'm a Christian, so I'm going to make sure I'm putting myself in their shoes when I'm doing any type of RUSAFE techniques. And always remember this. I always like to say this because I've had clinicians do this. Never look at the clock when you're doing an assessment. You'll lose the client's trust right off the bat. All right, existential therapy, logotherapy. Basically, we want to remember we're helping these folks find meaning in life. That's the existential framework. When we go through the assess portion, I've given you guys all handouts, and I have extra pens if any of your guys' pens don't write. Make sure you're looking at the existential framework. You're helping them develop meaning. For instance, a good referral for someone that's trying to develop meaning if they don't have a job, helping them get a job, helping them get substance help, use with substance abuse, helping them find faith, super helpful. If you have someone come in with a crisis and they haven't been to church in a long time, great referral to a chaplain or a priest. That's a wonderful referral. We do that all the time in the military. Let's see. Basically, the founding fathers of existential therapy is Viktor Frankl, Rollo May, and Irvin Yalom. I'm a big fan of Yalom. Basically, therapy through finding meaning for your clients. Next slide. The CDC recommends ask, care, keep them safe, be there, help them connect, follow up. We've adopted this in the military. This is from the CDC's website. In the military, we use ask, care, escort, and then in California, we also add follow up. In 2010, about time frame, there was this big program, this big push to put out these things called ACE cards, an awareness. So we got in this habit of using these tools among our soldiers. That's kind of where we got along the idea to use RUSAFE. RUSAFE, the first time I learned about RUSAFE was in grad school. My second year of grad school, it also is at Columbia University, and it's one of those common social work acronyms. You can find it online at studyblue.com, 2019. First thing you want to do is rule out medical issues. Are they under the influence? Safety questions. Assess. That's where you really want to make sure you're practicing the existential therapy through DICE. Determine, identify, clarify, explore. So you want to determine what the problem is, identify it, talk about it, clarify, make sure you're doing reflective statements and hearing them correctly, and explore solutions. That's where we talk about faith, we talk about finding a better job, helping them find better parenting skills or a referral for better parenting skills. But you want to make sure you're not solving the problem, you're having them solve their own problem. Empower the client, but acknowledge also their feelings of what's going on in the environment. All right, good case example, and we'll work on this together. 23-year-old Caucasian female comes into an outpatient care facility. During the assessment, she states, "I've been thinking of hurting myself." She appears to have small cuts on her left wrist. What do you do? Obviously, if you're using RUSAFE, let's scroll back up here, rule out medical issues, but you kind of already see where this is going. You'll rule out medical issues as a referral. Are they under the influence? You want to make sure he's not inebriated, but obviously there's some safety concerns. We'll go right to it. So SIHI, there's some valid safety concerns there, but the first thing you want to do is make sure she doesn't have a weapon on her. Your physical safety is number one, so everything stops. Make sure there is no weapon right there. But going through the tool, we'll rule out medical issues. Is she having auditory visual hallucinations? What's going on there? Is there any underlying issues going on medically that we can't think about? Dehydration. Is she inebriated? Definitely get labs done. Make her pee in a cup. That's going to be a nurse referral or whoever you need to at your environment. You obviously know there's some safety questions. How long has this been going on? Clarify the issue. Explore with her. Is there a family history of suicidal ideation? Has she stopped taking her medication? Is there medication? Acknowledge your feelings and then make sure you're doing appropriate referrals with either within the care facility or outside the care facility. All right, that's the same one. So basically, that's how we use the tool, basic understanding of it. Run through it one more time. Another case example, 19-year-old Caucasian male comes into an ER facility. During an assessment, says that he's been hearing voices. It's over 100 degrees outside, but the patient is not sweating. What do you guys think? I'd like to hear from you guys.
He's dehydrated.
Dehydrated? What are things, if he's dehydrated, we want to make sure we're going through the tool, RUSAFE, so ruling out medical. That's definitely, before we rule in behavioral health condition, definitely rule out medical. So under the influence, could, I don't know, maybe, could be. Safety questions.
Alcohol could make them dehydrated.
Alcohol, there could be definitely some alcohol concerns. Assess, but sometimes dehydration can cause auditory visual hallucinations. So yes, that's why this is a great tool. It could be a medical issue, not a behavioral health condition. So the first step I would do is clear him medically. Make sure he gets fluids in his system, and then the psychiatric referral. But both referrals should be done. So that's a good use of the tool. All right, another case example. 28-year-old Native American male comes into an outpatient care facility. During the assessment, says he's been seeing spirits. He appears to be relaxed and calm. What do you guys think?
I think this is where his cultural norms would come in because he's appearing to be calm and relaxed. Perhaps as a Native American, it's common for him to see. Exactly.
We don't want to overdiagnose. And also, he's calm and relaxed. If he was coming in nervous, anxious, fearful of these spirits or voices, that's where we want to culture relativism. That's exactly right. And also, a majority of those auditory visual hallucinations that are developing psychosis, 18 to 25. He's 28, so he's almost in the window, but he's really not, and he's calm and relaxed. So what affect is he showing to you as the clinician? Exactly, great way to use the tool. All right, so again, that's how we use the tool, and now we're going to do it through an existential framework, helping those people find meaning. So that's where we do the last portion. We're going to develop the plan and help them find meaning. So let's apply it. All right. So let's go through our next case example. 20-year-old Caucasian female comes into the ER facility after having a child. During the assessment, she says that she's been feeling depressed, low energy, and can't get any sleep. What do you guys think? What do you guys think? What are some good referrals here? So first we want to rule out medical, get some labs drawn up, maybe refer her to OBGYN, make sure this gets tracked if she has any additional children. Maybe refer her also to her psychiatrist. What else?
Well, I think first of all you need to look at the fact that she just had a child.
That's exactly right.
When did you just have the child yesterday?
Timing, yeah.
The child 6 weeks ago. And then that could play into the effect of the medical aspect of it. Is she anemic from just having the child?
Right.
Or is she anemic from not sleeping or taking care of herself because she's been taking care of that child?
Right.
So I think that would be the first thing, is to you have to find out a little bit more information from her.
Yeah, right, the dialogue part. And that's through the DICE, the Determine, Identify, Clarify, Explore. What are some meaningful, through the existential framework, referrals you might want to do with her? What are some meeting referrals, like maybe through her church? That would be helpful. Parenting referral, birthing center. What are some other ones?
Those three you just named won't cost any money, so that's why you mentioned those first.
Those are always good. Those are always cool. So also, I'm glad you said that. Insurance is super important. And that can be really tough when you're trying to do the existential framework, you know, helping them find meaning. Financial obligations, like, is there any other barriers to care? Financial barriers to care are huge. And sometimes they can just put a halt to everything if it's not appropriate. All right, so now this is where I'm going to have you guys do the group quiz. You guys will pair up. I'll take back your other handouts. And on your handouts, you guys will find the existential framework. Had you guys do the follow along part. And now here's where the quiz will come in. So let me pass out the quiz to you guys. There you go. There you go. Thank you, thank you. And you guys can be in group pairs. This is where it's called the think, pair, share. So I'm gonna pose the scenario to you guys. You guys think about it, discuss it, and then share. And I'll have you guys share your results. All right, last case example. 33-year-old Caucasian male comes into an outpatient care facility. During the assessment, says that he hurt his arm in his car door and he needs help. Although it appears that he is anxious, on edge, the arm appears to be freshly injured, and looks as if it happened minutes ago. So you guys, that's the question. You guys talk about it with each other, and I'll give you guys about 3 minutes, and we'll go over it.
Well, that's the obvious one for Rose, right?
Well, that's what I would say with the rule on medical issues.
Yeah.
It looks at addicted to painkillers.
Well, it's a chemical dependent approach. You think? I don't know.
Could be the opioid thing.
And make sure we're also developing the existential part with the framework. Make sure there's meaningful referrals there.
So the safety question is he doing this to harm himself or is he doing it to get pain medication?
Extent of the injury.
Yeah. Well, I'll put chemical dependence. Then it could be like your depression reaction.
Well, he's trying to harm himself is it
Yeah.
because he's depressed or suicidal?
I think it could very well be that it just happened. He got in the car and drove over.
You could, in your height, you do. Under the influence, you would order a blood test.
Mm-hmm.
Then that can also go into the medical
So,
assessment. Most
Assess through open dialogue. You need to ask a lot of questions.
look to see if there's other evidence when you're ruling out medical issues. You can look at
What do I do now? All my motorcycle guys are calling me rock and roll.
safety questions. First of all, I want to make sure that he's not. And then assess through open dialogue, asking some questions.
So when you're acknowledging his feelings, what you really want to find out about that is why. Why is he doing this? Why is he feeling the way he is? Why does he want the pain medication? Why does he want to harm himself?
I'll give you guys about another minute and a half. Take your time, but another minute and a half, and then we'll go over the quiz together.
What age you want? The age is.
He's 33 years of age. And he's going to an outpatient care facility.
He's looking for a quick fix.
I think through the open dialogue, you can also find out, first of all, does he have medical insurance? Why is he coming to an outpatient facility? Why didn't he go to ER? You know, why would he come there? So those would be the questions you would find out. And through those questions, it might help you to understand why he's doing what he's doing.
All right, I'm gonna go with this group first, and I'm gonna have them share their answer, and then I'll go over to you guys. If you guys would like to share your answer.
We initially wanted to take a look at the extent of the injury. We wanted to look at it, check and see whether there could be a potential break. Even if he's injured himself, he's going to need some sort of medical attention, or he's potentially going to need medical attention. So we want to make sure that there isn't something going on there. We want to look at it from the standpoint of not necessarily from the fact that he did it just to get drugs, that he did it, it was an accident and it just happened. It could be either, any number of things. So we want to look at the extent of the injury to begin with. Does it look like somebody just tried to hurt themselves? Well, talk to him a little bit about whether or not he's had these types of injuries, what other types of injuries he's had as well, just to get that information flowing. So we're going to make that visual and medical assessment, an additional assessment from a visual standpoint in that conversation to see whether or not there's any potential drug use as well as other things going on. As we're looking at him, especially with the arms and stuff, we can also that'll assist us in that assessment.
And what did you guys think about the meaningful referrals? What meaningful referrals would you guys focus on there?
Well, go ahead.
I was going to say,
Sorry.
that would actually need to come, before we could make those meeting referrals, that would need to come as we did more of the assess through the open dialogue, the types, determining, identifying, clarifying, and exploring. We would need to find out, for example, does he have medical insurance that would allow him to go to a different sort of facility that would say that. We would also just possibly find out if it appears that he has problems with substance abuse, then the referral may be, we want you to talk to a substance abuse counselor or someone who's more into that field, or then also maybe refer him to a clinic that could answer those patients. And then if it does find that he does have a substance abuse, probably want to dig deeper, maybe find out why. And then if he finds out, depending on those answers, you could refer him, you find out perhaps to the clergy. Do you need to talk to someone of the faith?
And that would be definitely a more meaningful referral. That's exactly the right train of thought. Perfect. All right, yeah. What did you guys think from the case?
Well, that's what we talked about. If it's so fresh, the guy's probably looking for drugs.
Okay.
I'd ask about who he is, where he's from, get his family situation right now.
Mm-hmm. Exactly. What's going on right now? What led him to this? Okay. And how long has this been going on? And this is usually a characteristic I've seen of someone who's been using a long time.
He just fight with his wife.
Okay, yeah, there could be some domestic violence problems there.
At the first few words, a person that goes to outpatient facility, you usually go to that for one of two reasons.
Mm-hmm.
It's not serious, so you don't think you need the emergency room or a hospital, or you don't have medical insurance.
So what do we really see here if we're looking, I'm sorry, I didn't mean to cut you off. What are we also looking for? Their motivation is drug use. That could be one you'd really want to rule out there, is under the influence. And also, is this person coming off something of the drug use? So some of the referrals I would recommend doing are definitely you might want to get a scan for his arm to see did he break something. But man, this would be one you'd really, hopefully the doctor would hesitate on doing pain meds, because it seems like there's a case history here. And you would really want to hope that they go down a different route. You can also usually get their treatment record and see if any other local outpatient facilities are referring, or call the local pharmacy of where he wants the drugs dispensed and get a list of how much drugs he's getting dispensed. Usually California has a lot of regulations and rules on this.
Time though, this is supposed to make everything rapid, right?
Yeah, that's what the RUSAFE tool is for appropriate referrals quicker. So we discover things like this right away and we make sure, okay, we're looking at under the influence. Okay, we're looking at safety questions. This is more medical. But we're going to make the other referrals too, but what are things we really want to jump towards to help us make sure we're not forgetting anything in our RUSAFE tool? It's going to help us identify the problem and make sure we almost logically make sure we check everything off there. But we're also applying appropriate diagnostic and clinical skills.
You can visually assess a person very quickly as to their body language, their eyes, their pupils.
And that would be, if we're using RUSAFE, where would we put the physical assess? I'd put physical assess, but also safety would be there. For instance, if you saw someone with open lacerations or cuts, superficial in nature or deep, it doesn't matter. That's where you're going to ask the safety questions a couple different ways. How long have you been feeling this way? Is this passive SI? And do you trust their answers? Trust is a huge factor. Also, their age. If they're younger, they're going to be more impulsive with the suicide. If they're older, less impulsive. But majority of suicides, men, Caucasian, over 40, that's majority of suicides. So you want to make sure, you want to look for statistically significance, rule that out, and you also want to look at their age, what's going on there.
What they're saying match what you're visually observing.
Right, exactly. Someone can say, I'm fine, and they do not look fine. That's where you look at their reaction. What's their physical appearance? Are they well kept? That's definitely something you want to look at. But also, for instance, the last gentleman we just assessed through substance abuse issues. What would have been good ways for, in terms of a Viktor Frankl's view about helping them find a better meaning? Say he had substance abuse issues. What would be some good, meaningful referrals for someone with substance abuse issues? And now, come from your guys' experience here and tell me what you guys think. I'll just finish with you guys, so I'll go back to here. What do you guys think some meaningful referrals would be for this gentleman?
Well, first of all, you have to get him, for lack of a better term or clinical term, to get them clean and sober. Because there won't be anything that they can do as long as they're still fighting that. So they have to be connected to programs that will help them find their value as they work their way through that. So they have to be able to feel valued right off the bat, that as a person, I'm valued, and what I'm going through is difficult, but it's not something that takes away my value permanently. I can find my value again. So I would go back to, since he's on a substance abuse, perhaps a outpatient treatment. Outpatient treatment. Or a live-in program.
Yep.
For home, so we're living.
And there's some religious ones that you could do too. What would be the religious ones he could go through?
There's Celebrate Recovery.
Yep, Celebrate Recovery.
Which is a outpatient, you don't live there. And then there's also Teen Challenge,
Yep.
which is a live-in program.
And that's a local one here in the Central Valley. And that'd be great depending on, I forget his age, 33? 30, let's see, go back here. I think his age, 33. So that'd be perfect for Teen Challenge. I think they have several folks around that age.
I think that also takes into consideration your locale.
Yes.
If you're in Kern County.
Yes, and we tend to have, exactly,
as opposed to another one. So I think that, knowing, as you talked earlier, your cultural norms.
That's exactly right. Incorporating that into the RUSAFE plan when you're ruling out things. But that also helps with the meaning portion. Knowing your area, help them develop a new meaning. It's very, very important. What do you guys think? What are some good, meaningful referrals?
Well, that's right, though, because there's because of the what we want to call it, the demographic part of Kern County has a lot of people that are transit, that have medical problems, and no income, low income. So there's Teen Challenge and all these different organizations.
And there's some other factors here with RUSAFE too, when you're using it, where you would want to incorporate it. When you're using RUSAFE, so cultural issues, we talked a lot about that, then with the Native American case, your local area culture issues, knowing that we have some major drug problems here in the Central Valley. Meaningful referrals. What if the person came in and lacked faith? Would you ever want to project them down the faith path?
I don't think that's up to you to do that.
That's exactly right. You want to stay where you are ethically. And now if you are at an ER facility and there's a chaplain that wants to assess, make sure you're staying in your lane. Just because if you're a Christian, Muslim, or whatever faith you might believe in, make sure you're not projecting your religious values onto them. So it's important to go with Viktor Frankl's idea, but make sure you're not projecting your religious beliefs onto them, because then you're going to really be on some dicey land there ethically. Yeah, go ahead.
I'm sorry. That would come under the empowering the person.
Yes. Definitely.
Looking at what do they believe in. Oh, I can, letting them make that decision and telling you. So if I am of a certain faith but they're not, you can empower them by not pouring that on there. You let them decide who they are.
Exactly.
Well,
That's exactly right.
Asking them about their personal life situation, you get a lot of clues from them. I actually had a situation where I did have somebody that wanted to hurt me, and I turned it back onto them, and I asked them about themselves. I made it very personal to that person.
No, that's great.
And I was able to not get hurt, be out of it, and that person then now, his attitude changed by the end.
Good.
And he was now going to deal with his situation differently.
Good. No, that's exactly right. Do you think, bringing that example, do you think using this tool in that scenario would have improved things?
To a certain extent, I sort of did. Having been more aware of it, I probably could have gotten to my end result sooner than it, or without me being, I got very, it bothered me personally too, because I didn't have this tool. I was kind of instinctively knowing what to do. But to be honest with you, when it was over, I drove down the street and cried.
Oh, yeah. Well,
If I had the tool, I probably would have would have felt more comfortable with what I was doing and how I was handling it.
Right. Well, and also it can help compartmentalize things. So it can help give you maybe a sense of not being overwhelmed by the situation because you have a compartment to put things in and you've ruled things out and it give you a direction to treatment. So really it's not, it's not everything, but it definitely can give you another tool in the bag to know in a crisis, we want to simplify things. We want to stop thinking about so many things and make it very simple, but doing it through an existential framework and giving them meaning is very, very helpful. Now, we're going to move on to our last part of this class, basically. I'm going to go over some common diagnosis that I kind of have an open dialogue with you guys. What are some good diagnoses this would work for, and what are some ones that wouldn't? What do you guys think? What are ones, where do you think the tool would struggle?
It's more to rule out things, to know where to go.
Yeah. Yeah.
If it's not drugs, then why do they hurt themselves? Then is it depression? What caused the depression?
And that's where we're going to wait for those referrals to come back. When we do a psychiatric referral, a medical referral, basically get them to their primary care physician. You want to get their case history. That'd be really, really helpful.
Doing things fast, though, you can't wait for referral. You got to figure out on your own.
Well, sometimes, but in a crisis setting, at least you'll go through and make sure that they'll be stabilized. They'll have care with them. They'll be under medical hospitalization. Yes.
You're talking about using this tool in a crisis situation.
Yes.
You're asking questions on where it would not be.
Yes, exactly.
Beneficial.
Yeah.
Then it would be a non-crisis situation, which would be the day-to-day life. I've gained a little bit of weight and I'm not happy.
Exactly.
about that.
Exactly.
That is not a crisis. Or
Right.
I'm a little bit tired, a little bit stressed at work. I've got this project deadline.
Right.
That is not a crisis. The tool overall would also, as you were stating earlier, would help you to narrow down those things. Oh, this is not a crisis based upon what the tool says, but this is, and we're going to jump to that using that. But there are some areas that it wouldn't necessarily need to be used.
It's not always a one-size-fits-all, but it's great in a crisis to help you calm down, help you prioritize things, and make sure that, I can't tell you how many times I've left a crisis and I'm like, oh, did I do this? Oh my gosh, I can't believe I forgot this. Or it'll help you put things together to make sure you are checking things off appropriately, but professionally, and making sure that you're, being the best possible clinician in the setting. So
Isolate the things that aren't the problem.
exactly, and you can rule those out right away. But also, for instance, let's go back just one sec here to one of our first cases. The first case where we had, let's see, here we go. First case was right here. 23-year-old Caucasian female comes into outpatient care facility. Now that you guys have gone through the whole training and everything, she's been thinking she's been hurting herself and appears to have small cuts on her arms. How would you now, using this tool, how would you handle this?
Psychosis out first.
I wouldn't say psychosis right away.
Hurting herself, why?
Yeah, why is she hurting herself? It could be depression, severe depression. So it's obviously definitely in the realm of behavioral health, the safety questions first. So you jump right to it. That's exactly what you need to. You need to stick, that's why the tool is very helpful. There's some medical things there we need to consider, but that's why we recommend the tool. The tool is very helpful.
Medications, and sometimes these things are caused because you're not taking your medication.
Right, or because you're having an adverse reaction to medications. That's the rule out medical. Exactly. That's where these are helpful. Now, I want to get into basically the last, I think there's about 2 minutes left here. What did you guys think of the course? Was the course helpful to you guys?
The breaking down of the tool itself and giving us the RUSAFE acronyms and being able to say that this is what you want to learn as you're going through it, but to understand that you can jump down to a different letter, so to speak, that you don't have to, oh wait, I have to get through this.
Yes, you do not have to do it, right, exactly. You don't have to do it in order.
All of them was very helpful.
Yes, you don't have to do them in order, and I recommend you have to do, I would do all of them, no matter what referral you're going to do, but you don't stop doing it, right? The minute you're at the one like, oh, yep, there's safety questions, we stop everything. Make sure you go through the whole tool. Exactly, that's exactly right.
Gives you confidence in handling the crisis a little easier because you have that tool. Because I think back to the situation I was in and I didn't have the tool, so I was having a hard time getting through it because I didn't have the tool. The tool would have made it easier, faster, given me more confidence, and I wouldn't have been so personally affected.
And maybe overwhelmed. It, like, can help you critical think it and put it in a logic box. Can be very, very helpful. Well, that basically concludes my brief. I'm gonna, those are for you guys to take home, and I would like to look at your guys' stuff to grade it and just to give you guys some feedback, additional feedback, and let you guys know how you did. You guys have any further questions or concerns for me? No? Thank you so much. That concludes my brief.
Thank you.